Hey everyone, welcome back to NCLEX Practice Hub. Today, we're diving deep into one of the trickiest topics on the NCLEX, electrolyte imbalances, specifically sodium and potassium. We'll be tackling 20 hard-level, select all that apply, questions to help you master this topic. Remember, in these questions, you need to select all the correct options to get the point. Let's get started. Question 1. Which of the following are clinical manifestations of hypernatremia? Select all that apply. A. Thirst. B. Muscle twitching. C. Bradycardia. D. Dry mucous membranes. E. Increased urinary output. Correct answers: A, B, D. Explanation: thirst, muscle twitching, and dry mucous membranes are common signs of hypernatremia due to the body's attempt to correct the high sodium levels by increasing fluid intake and expelling water. Question 2. Which interventions are appropriate for a patient with hypokalemia? Select all that apply. A. Administering potassium supplements. B. Encouraging high potassium foods. C. Restricting sodium intake. D. Monitoring ECG. E. Administering calcium gluconate. Correct answers: A, B, D. Explanation: administering potassium supplements, encouraging high potassium foods, and monitoring ECG are appropriate interventions to manage and monitor hypokalemia. Question 3. Which of the following are causes of hyperkalemia? Select all that apply. A. Renal failure. B. Use of potassium-sparing diuretics. C. Cushing syndrome. D. Excessive dietary intake of potassium. E. Alkalosis. Correct answers: A, B, D. Explanation: renal failure, use of potassium-sparing diuretics, and excessive dietary intake of potassium can lead to hyperkalemia. Question 4. Which symptoms are indicative of hyponatremia? Select all that apply. A. Confusion. B. Seizures. C. Hypertension. D. Headache. E. Dry skin. Correct answers: A, B, D. Explanation: confusion, seizures, and headache are symptoms of hyponatremia due to low sodium levels affecting brain function. Question 5. In a patient with hypokalemia, which ECG changes might you observe? Select all that apply. A. Flattened T waves. B. ST segment depression. C. Peaked T waves. D. Presence of U waves. E. Widened QRS complex. Correct answers: A, B, D. Explanation: flattened T waves, ST segment depression, and presence of U waves are common ECG changes associated with hypokalemia. Question 6. Which of the following conditions can lead to hypernatremia? Select all that apply. A. Diabetes insipidus. B. Cushing syndrome. C. Diarrhea. D. Inadequate water intake. E. Heart failure. Correct answers: A, B, C, D. Explanation: diabetes insipidus, Cushing syndrome, diarrhea, and inadequate water intake can all lead to hypernatremia due to loss of free water or increased sodium retention. Question 7. What are the nursing interventions for a patient with hyperkalemia? Select all that apply. A. Administering insulin and glucose. B. Restricting dietary potassium. C. Administering sodium polystyrene sulfonate. D. Encouraging fluid intake. E. Administering loop diuretics. Correct answers: A, B, C, E. Explanation: administering insulin and glucose, restricting dietary potassium, administering sodium polystyrene sulfonate, and administering loop diuretics help lower potassium levels. Question 8. Which laboratory findings are consistent with hyponatremia? Select all that apply. A. Serum sodium level less than 135 milliequivalent/L. B. Increased urine-specific gravity. C. Serum osmolality less than 280. D. Elevated hematocrit. E. Decreased BUN. Correct answers: A, C, E. Explanation: serum sodium level less than 135 milliequivalent/L, serum osmolality less than 280, and decreased BUN are indicative of hyponatremia. Question 9. What are the signs and symptoms of hyperkalemia? Select all that apply. A. Muscle weakness. B. Paresthesia. C. Tachycardia. D. Nausea. E. Hyperactive reflexes. Correct answers: A, B, D. Explanation: muscle weakness, paresthesia, and nausea are symptoms of hyperkalemia due to high potassium levels affecting neuromuscular function. Question 10. Which medications can cause hypokalemia? Select all that apply. A. Loop diuretics. B. ACE inhibitors. C. Thiazide diuretics. D. Beta blockers. E. Corticosteroids. Correct answers: A, C, E. Explanation: loop diuretics, thiazide diuretics, and corticosteroids can cause hypokalemia by increasing potassium excretion. Question 11. Which of the following are treatments for hyponatremia? Select all that apply. A. Fluid restriction. B. Administration of hypertonic saline. C. Loop diuretics. D. Sodium bicarbonate. E. Increased oral sodium intake. Correct answers: A, B, C, E. Explanation: fluid restriction, administration of hypertonic saline, loop diuretics, and increased oral sodium intake help treat hyponatremia. Question 12. Which clinical manifestations are associated with hypokalemia? Select all that apply. A. Constipation. B. Hyporeflexia. C. Weak pulse. D. Metabolic acidosis. E. Polyuria. Correct answers: A, B, C, E. Explanation: constipation, hyporeflexia, weak pulse, and polyuria are signs of hypokalemia due to low potassium levels affecting muscle and kidney function. Question 13. What are the risk factors for developing hyponatremia? Select all that apply. A. Excessive water intake. B. SIAD. C. Congestive heart failure. D. Vomiting. E. Hyperaldosteronism. Correct answers: A, B, C, D. Explanation: excessive water intake, SIAD, congestive heart failure, and vomiting are risk factors for hyponatremia due to dilutional effects or loss of sodium. Question 14. Which dietary advice is appropriate for a patient with hypokalemia? Select all that apply. A. Increase intake of bananas. B. Increase intake of spinach. C. Increase intake of oranges. D. Increase intake of potatoes. E. Increase intake of apples. Correct answers: A, B, C, D. Explanation: increasing intake of bananas, spinach, oranges, and potatoes can help manage hypokalemia by providing dietary sources of potassium. Question 15. Which conditions can lead to hypokalemia? Select all that apply. A. Diarrhea. B. Vomiting. C. NG suctioning. D. Hyperaldosteronism. E. Addison's disease. Correct answers: A, B, C, D. Explanation, diarrhea, vomiting, ng suctioning, and hyperaldosteronism can lead to hypokalemia by increasing potassium loss. Question 16. Which interventions should be included in the care plan for a patient with hyponatremia? Select all that apply. A. Monitoring serum sodium levels. B. Restricting fluid intake. C. Administering diuretics. D. Providing oral rehydration solutions. E. Administering intravenous sodium chloride. Correct answers: A, B, E. Explanation, monitoring serum sodium levels, restricting fluid intake, and administering intravenous sodium chloride are important interventions for hyponatremia. Question 17. Which symptoms indicate severe hyperkalemia? Select all that apply. A. Cardiac arrhythmias. B. Muscle paralysis. C. Severe hypotension. D. Diarrhea. E. Hypertension. Correct answers: A, B, C. Explanation, cardiac arrhythmias, muscle paralysis, and severe hypotension are symptoms of severe hyperkalemia due to its effect on cardiac and neuromuscular function. Question 18. Which electrolyte imbalance is most commonly seen in patients with Cushing's syndrome? Select all that apply. A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypophosphatemia. E. Hypermagnesemia. Correct answers: B. Explanation, hypernatremia and hypokalemia are common in Cushing's syndrome due to increased aldosterone activity. Question 19. What are the potential complications of untreated hypernatremia? Select all that apply. A. Brain damage. B. Seizures. C. Coma. D. Respiratory arrest. E. Hypertension. Correct answers: A, B, C, D. Explanation, brain damage, seizures, coma, and respiratory arrest are potential complications of untreated hypernatremia due to severe dehydration and cellular dysfunction. Question 20. Which of the following are common signs and symptoms of hypernatremia? Select all that apply. A. Restlessness. B. Agitation. C. Hypotension. D. Oliguria. E. Hyperreflexia. Correct answers: A, B, D, E. Explanation, restlessness, agitation, oliguria, and hyperreflexia are common signs of hypernatremia due to the effects of high sodium levels on the nervous system. Great job, everyone! Remember, understanding the nuances of electrolyte imbalances can be a game changer in your NCLEX prep. If you found this video helpful, give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss an update. Keep practicing, and you'll be acing the NCLEX in no time. Until next time, happy studying!